And now I'm going to invite Alison Anway and Andrea Hans, our public policy manager, to join me. I have, Allison, a lot of questions for you. I know you got to hear Edwin's presentation, but I want to just start with if you could tell. Okay, first of all, if you can read Allison's bio, and it notes that she worked for a Republican senator during the whole Affordable Care Act enactment back in 2010. So she's definitely very familiar with these topics and understands the process, how we got here, and also, I think one of the issues here is just that it is the Republicans have always had concerns with the Affordable Care Act, and that doesn't make them excited about extending these tax credits. But before we get into all of that, can you just tell us the kind of landscape now in Washington now that Congress is back this week after their August recess, and funding, they need to fund the government by September 30th. So can you just kind of give us a overview of the lay of the land?
Sure. So first of all, thanks so much for inviting me, and it's nice to be with you all this afternoon. So the mood in DC right now is very hostile. Democrats and Republicans, I feel like we say this all the time, but it just becomes more and more true. They're very, very hostile to each other for a variety of reasons. Republicans right now have control of the White House, the Senate, and the House. And because of that full control, they were able to muscle through in a very partisan fashion two really important pieces of legislation. One is the One Big Beautiful Bill that contained all of the Medicaid cuts and a variety of other things. And the other was something that was called a rescissions package, which has to do with the White House's ability to claw back funding that the Congress had previously appropriated. Democrats are absolutely furious about both of these bills that passed without any Democratic support. And they are really feeling like they don't want to play ball with the Republicans when it comes to passing anything. And that includes government funding. And so that's going to set up a showdown over the next couple of weeks because, as Edwin mentioned, government funding. It runs on a fiscal year, and so it is currently set to expire at the end of September. There's no way that they're going to get bipartisan agreement on all of the appropriations bills that need to be passed by the end of September. So what's likely to happen is Republicans will offer a stopgap funding measure, which is called a continuing resolution. It basically just keeps funding levels the same as they were the previous fiscal year for a period of time. And that is to allow for bipartisan consensus to come around to develop around a bigger omnibus appropriations bill, hopefully by the end of the year. Congress has been doing this every year for many years now. The appropriations process has been a mess for a while now. But this year, it's even more of a mess because of the heightened tension between the two parties. And unlike the One Big Beautiful Bill and the rescissions package, Republicans absolutely need Democrats to support the appropriations bill because both the One Big Beautiful Bill and the rescissions package had special rules that allowed them to pass through the Senate with just a simple majority, which the Republicans had. But the appropriations bills need to have 60 votes in the Senate, which Republicans do not have. So they need to get some Democrats to support the government funding package and any continuing resolution that they try to pass. And that's going to be taking up most of the oxygen in the room in the month of September. And then if they are able to get a continuing resolution, it will take up most of the oxygen in the room for the rest of the year.
Yeah. So, and I want to ask you too, just about the hearing yesterday with RFK and if you think that affects this process at all, because it definitely showed the tension between the two parties. I will say that Cancer Nation, sent a letter to the committee chairs, along with others in the cancer community, other patient advocacy groups, asking them to talk with RFK Junior Secretary Kennedy about the importance of scientific leadership at CDC, and because CDC has a number of cancer programs that need to be scientifically based, and concerns about the exit of the leadership because they felt like they were not able to pursue the effect, to pursue science in a non-politicized way. So that was a really wild hearing. I watched most of it. Like, does that factor into whether or not these guys can cooperate? Because as you said, they need 60 votes for the appropriations bills.
It absolutely does. And I think, in addition to the bills that passed without Democratic support, definitely the overall mood is also negatively impacted by just everything that President Trump and his secretaries, his agency heads have done that, Democrats disagree with. And obviously the sort of upheaval at the CDC, the changes to grant funding at the NIH, changes to grant funding at the Department of Defense, all of those things feed into the overall hostility between the Republicans and the Democrats right now. The issue for the Democrats is that if they don't vote to advance at least a continuing resolution, at least a stopgap funding measure, they run a very high risk of being blamed for a government shutdown. And past examples of government shutdowns have proven that the party that is blamed for a government shutdown ends up paying the price in the next election cycle. The other problem that the Democrats have is they don't have a ton of leverage in order to try to extract concessions out of the Republicans when it comes to the appropriations process. But one of the things that is very high on their priority list is the extension of the enhanced premium tax credit subsidies. And just to put a fine point on it, I saw a question in the chat, like, why does this matter for, cancer care? And I just wanted to double click on what Edwin said, or maybe it was Shelley, that, loss of coverage, loss of insurance coverage often equates to loss of access to healthcare, and particularly preventive services, cancer treatment, things of that nature. So, a 16 million or 11 million or 6 million, however many people lose coverage, that also equals potential loss of access to care. So that's why this is important. But as I said, Democrats would very much like to trade, sort of horse trade, negotiate their support for a continuing resolution or an omnibus appropriations bill for the inclusion of some kind of extension of these enhanced premium tax credits. And, as Edwin mentioned, there are some within the Republican Party who also feel like an extension needs to happen. The bill that was introduced yesterday was introduced by 10 Republican members of Congress on the House side. All 10 of these members are in battleground districts that they are going to have a very hard time holding on to their seats in the upcoming midterms. And all of them had to sort of, in their view, hold their nose and vote for the one big beautiful bill, even though it was already very unpopular with their constituents. So they feel like there is a political reason on top of a just, policy and sort of benevolent patient care reason for passing at least a short-term extension that gets them, at least through the midterm election cycle, and then, see what happens after that.
And can you talk about I heard that yesterday Speaker Johnson acknowledged that this is an issue that they need to grapple with. What can you talk a little bit more about what he said and what does that mean?
Yeah, so this issue has really been a little bit of a sleeper issue. I mean, not surprising, with just given the volume of policies that have come out from the White House, from HHS, from Congress, in the last 6 months. I think that this issue's kind of been bubbling beneath the surface, and Republican leadership didn't really want to deal with it until they were forced to deal with it. And so, I think they're sort of waiting to see, right now the One Big Beautiful Bill is not polling very well. They're not getting good polling numbers. Republicans were sort of hopeful that, during the August recess period, when they were back in their states, back in their districts, had the opportunity to talk about the bill, explain what they perceived to be the benefits, that could sort of right the ship when it comes to polling numbers. And I very much think that they're still kind of waiting to see what the polls say as they get closer and closer to the end of the year. And I think they'll wait until the last possible second before they, decide whether or not to throw their support behind, for example, the House Republican bill that I just mentioned. That does create a challenge for open enrollment, as Shelley mentioned. Open enrollment will start probably before they deal with this issue. But if they do pass something by the end of the year, perhaps as a rider with the appropriations bill or with the National Defense Authorization Act, then they will at least be able to say, we did extend the subsidies. Maybe there's a special enrollment period, and they'll have something positive to say as they're going into the midterms to try to protect their majority, particularly in the House.
Yeah. Andrea, I want to ask you because you've been participating in a lot of meetings with staffers talking about this. What are you hearing from them? And also, I know you've said before that they didn't seem to get the urgency and that, even the timing of this, that while there may be ways to address it if it happens too late, it's also really challenging and we can't really wait till the end of the year.
I think now is a really different time than it was maybe a couple months ago. So I think now they're feeling a little bit more pressure. Lawmakers are feeling a little more pressure. I think they've been hearing more from their constituents, but I think that's the power of advocacy and people like sharing their stories and calling in because they're saying, I think in like a few states, that's what they get the most calls about. A few offices have been saying we're getting a lot of calls from constituents, and it's mostly about these healthcare tax credits. And as Allison mentioned, there are these 10 lawmakers that introduced this bill. So there is willingness to work together on this. And it just comes down to this funding deadline, September 30th. So I think more people are feeling pressure.
Yeah.
And from an advocacy perspective, I mean, I would just say, I think it's really important when you're looking at your congressional delegation and you're thinking of reaching out to them about this issue. I think it's important to understand the differences in the sort of concerns and sort of the objectives of both sides. So on the Republican side, right away, you run up against like several big hurdles to them supporting an extension of the tax credits. First of all, they're associated with the ACA. The ACA has always been the Republicans have always been very hostile to the ACA, have tried to overturn it, famously failed to do so. Secondly, they're associated with COVID and COVID policies because they were enacted as part of the American Rescue Plan under the Biden administration during, the COVID policy reaction. And a lot of Republicans would like to undo every COVID policy that passed during that period. Third, it's inconsistent with the One Big Beautiful Bill. I mean, the One Big Beautiful Bill, obviously, included cuts to coverage in Medicaid, as well as, trying to root out perceived waste, fraud, and abuse. And then the fourth thing is it's expensive. Extending these subsidies is not free, it is expensive. I believe that the Congressional Budget Office scored a 10-year extension as costing $350 billion. So those are sort of the concerns that most of the Republicans have. But I think the thing that works with Republican offices is to emphasize, the fact that if these subsidies are just cut off and there's no sort of exit plan, there's no sort of runway or phase out or alternative coverage that's offered in its place, people are just going to lose coverage and they have nowhere else to go. And that's going to be a huge political liability for the Republicans going into the midterms. And remember, their number one objective is to protect their majority. So, making sure to message to them that you can't just turn it off, 100% at the end of this year. At least give us one more year, at least give yourselves an opportunity to come up with a plan B for these people that are going to lose coverage. I think that's a winning message on the Republican side. On the Democrat side, the challenge is different. They don't want just a 1-year extension. They want these enhanced subsidies to be permanent. They would even like to expand them even more. And they also they don't want to play ball with the Republicans on this. They don't want to give the Republicans a political win going into the midterms. They would love to be able to saddle Republicans with, the blame for all of these people losing their coverage on top of the Medicaid cuts in the one big beautiful bill. So I think the messaging for Democratic offices is a little different, which is don't let perfect be the enemy of good. A lot can change in a year. The House could flip, the Senate could flip. We could be in a very different situation politically in Congress at the end of next year. So at least pass an extension of 1 year, and then let's see where we are at the end of next year. So the messaging, I think, just needs to be a little bit, a lot cognizant of the differences between the offices and what they care about and what they're trying to achieve.
So we've got Andrew's put into the chat a link to a really great fact sheet that kind of explains what to talk about when you make a call, and what's also really important because members of Congress care about their constituency. On the second page of it is the number of people who could lose coverage as a result of the end of the premium tax credits. So that's a really helpful resource. But I wonder if you could, Allison, when you worked in the Senate office, you had lots of meetings with constituents, and we do, prep people for meetings in person a little bit differently because you're going to be you have the meeting is 15 to 30 minutes. But when you're calling, you're not really getting into a long spiel. Like, can you talk about the difference in when you're making a call to an office? Because oftentimes you're really going to talk to just the receptionist who answers and not necessarily the health staffer. Sometimes they may transfer you to the health staffer, but they're more just kind of taking like they need to know what you're calling about, and sort of I've even seen offices where they just have like a tally sheet and they're like tallying people who are calling for and against. So can you talk a little bit about how to make that call effective when you're making a phone call, when you don't have as much time to talk about all the details?
Yeah, yeah, absolutely. And you're 100% right. If you're calling your congressman, your congresswoman, your senator, you're not going to talk to the member of Congress, and you might not even talk to the healthcare legislative assistant. You probably are going to be talking to a receptionist, maybe a legislative correspondent, but it's still important that you call because they do keep track of what calls they're getting and how much volume they're getting on specific issues. And that's really powerful for the member when they get at the end of the day or the end of the week. Oh, we had another 50 calls today on, support for extending the subsidies. And I think that in terms of being as impactful as you can, aside from just logging your support, making sure that they know that you are a member, you do live in the district or you do live in the state, you are their constituent, and a sentence or two about how the coverage expansion has directly impacted your ability, your family's ability to access healthcare and your concerns about your access that you're going away if these subsidies are not extended.
And if you aren't personally using the subsidies, you can talk about being a cancer survivor and you're, or a caregiver or, a clinician, and you care about the cancer survivors that who really rely on this because they may not be able to work and have, or they may not be able to have employer-sponsored health insurance. They had, pre-existing conditions before that kept them from getting plans. So these plans are really important to them.
Yep.
You talked before, you mentioned some of the provisions are being challenged in the courts, or we talked about that. Are there any cases that are going to affect this that are working their way through the courts?
Um, there are, and what I would say about the court cases is um, a, a decision from a court is probably not the ideal solution. It might help in the short term, or it might help a limited number of people from, that court's jurisdiction. But at the end of the day, what we really need is a congressional fix. This is something that really only Congress can fix in a meaningful and uniform way. And as I mentioned, even a year extension would give us some breathing room. It would allow for the development of some kind of an alternative coverage plan, or it would allow for the political situation in Congress to change and perhaps be more amenable to a longer term extension.
I think though for grassroots, constituent calling, I don't know that you need to get into the details of how long the extension should be. I mean, I think you could just say this is really important. And again, they're keeping tally of 50 people called in support of these tax credits. I don't know that they're going to be looking at how many are saying permanent versus how many are saying 1 year. I mean, I think our position is that they're important and we want them extended. A year is better than not being extended at all, but it's definitely, still puts us in a difficult situation. But I'm not sure that's something we can have those conversations when we're in meetings. But if you're just, if you're a constituent calling, I don't know that their expectation is that that level of, how long they need to be extended.
Yeah, my one concern is that the political hostility is so bad right now that I could see a situation where the Democrats have they've introduced a longer term extension and they dare the Republicans to vote against that. The Republicans then have introduced this 1 year extension. They dare the Democrats to not vote for that. And it just devolves into this political back and forth blame game when, even just a short term extension would at least kick the can down the road and allow for coverage to stabilize for another year as things develop.
Yeah, and we know Congress is good at kicking the can down the road.
Mhm.
Um, Also, I just want to ask one last question about research funding. When we were on the Hill in June, we were talking about the importance of research funding. The president's budget had proposed huge cuts to NIH and National Institutes of Health. And what we kept hearing, at least I was in mostly Senate Republican offices, and they were saying, don't worry, it's okay, we're not going to do that. And I was worried, but it does seem like at least the initial action has been to keep levels and to not have those kinds of cuts. So it's not the usual situation where like a CR might be our best case scenario, but it does seem like there's not the appetite for cutting research to the levels that or cutting research at all, really. Could you comment on that?
Yeah, and that's particularly true in the Senate. The Senate has shown that they are very supportive of increasing funding for the NIH and specifically for federal cancer research. I think where we run into problems is on the House side, where House Republicans in particular are, sort of more open to supporting the cuts that President Trump has proposed. But the Senate typically has the upper hand when it comes to these appropriations battles. And so I think that the fact that the Senate is holding firm, not just holding firm, but actually supporting increases, is a really good start.
Yeah, great. Andrea, do you have any other questions or comments you want to make?
No, if anyone has any questions about the fact sheet, they can feel free to reach out. But all the information is there. Hopefully it's, helpful when you're calling your representatives. And yeah, time is of the essence. So thank you so much.
Thank you, Allison. I really appreciate you joining us, and I think it's really helpful to hear the political motivations behind what's going on, and that helps us in crafting our arguments. So I really appreciate your time and sharing your expertise.
Absolutely. Thanks so much for having me.
Thank you. And now I'm going to hand it over to Veronica Paniotu, who's going to introduce our next speaker. Thank you, Andrea. Thanks, Veronica.
Thank you, everybody. That was wonderful.